Well, this webinar is organized by Psy Global and Remco van der Wijngaard. My name is Ursula de Korte. As Learning and Development Manager at Psy Global, I am, well, delighted to have you all here with us tonight. And now I would like to introduce Beer Jonkers to say a few words about tonight's webinar.
Good evening. Thank you, Ursula. Good evening, everyone. Nice to see a lot of people attending this webinar. I think some additional people will follow. So my name is Beer Jonkers. I'm founder of Psy Global together with Esther Heijma, and I will be moderating a little bit this webinar. So in case there are any questions, I will have a look at the chat. I will make sure that we will collect all the questions, and then if we are not able to answer all these questions, we will try to answer them later after the webinar, and then we will send you a document so that everyone got their answers and we can fully enjoy the webinar that Remco will provide. Let's see if there are any other house rules that I wanted to first discuss. As Ursula said, we would prefer if you keep your camera on, but the microphone off. If you have a question, you can raise your hand or send it in the chat. We will try to answer them. If possible, we will also try to post this webinar later on our website. So thanks, everyone. And then the floor is yours, Remco.
Wait, well, I can introduce Remco a little bit for the people who I can't imagine, but some people may not know Remco. Well, yeah,
there'll be quite a few people not knowing me.
I don't know, but it is our pleasure to have you here tonight, Remco van der Wijngaard. Remco is a leading expert in the field of schema therapy, has been instrumental in advancing this therapy, both in the Netherlands and internationally. He has years of experience as a psychotherapist, trainer, supervisor, worked extensively with people struggling from various disorders, personality disorders, other complex psychological problems. And well, in addition to his clinical work, Remco is known also for his contributions to training mental health professionals, making schema therapy more accessible and practical for therapists around the world. He's also an inspirational speaker and educator, sharing his expertise at conferences and seminars worldwide. So we are honored to have Remco with us tonight, and we're looking forward to gaining valuable insights from his experience. Please welcome Remco.
Thank you so much for these warm words. I must say, if it's about schemas, it is a bit schema activating to hear so many beautiful words. Well, thank you so much. It's not about me, but I'm just being very happy and honored to be here together with you. Nice to see your faces, Milena and Alejandra, Elena. Is that Natasha? Did you say it correctly? Nice to meet you. And T, Hatim, good to see you as well. Hey, people who are listening, please, if you're able to turn on your camera, I'd like to connect if possible. But I also get it when you just would like to know about the content, because that's what you signed up for. You would like to know a bit more about schema therapy. Maybe it starts with a question from my part. How many of you know a little bit about schema therapy? For the people that I can see, let's have a raise of hands. For how many of you is schema therapy unknown? You've heard about the name, but this will be the first time that you hear something about what it actually is about. How many of you are unfamiliar? Okay. How many of you do know something about schema therapy? You've heard it, you've maybe been reading a book about it, but that's it. So you might be interested to get to know more to learn more about it. What about the others? Alejandra, Elena, do you already work with schema therapy? Is this something that you already have in your practice, or? And Elena? Do you work with schema therapy, or is this something new to you?
No, I don't work with schema therapy. So I have heard of it and have some basic notions, but I subscribe to learn more about it.
Yeah. Okay. Well, good to know. I mean, just to get a sort of a flavor of what your level of knowledge is. And that's exactly what I would like to do. I would like to introduce you to the model. So if you don't know anything about it, that's totally fine. It is a relatively new form of psychotherapy, developed in the 90s of last century. So Jeffrey Young considered to be the founding father of this model. And I would like you to, this is a slide just to point out maybe how widely known it now is across the world. So there are many translated books, that's what the slide says. But if you just travel around the world, or if you look at what's being put out there in terms of publications, a lot of places in the world people are doing schema therapy. So it's quite popular. That doesn't mean to say that it's therefore also good, but well, it's nice to know that apparently this appeals to therapists and clients. And I would like to sort of introduce you to some of its basics, so maybe you also might feel inspired to learn more about it. And that's what I would like to do. I would like you to sort of first talk a little bit about schema therapy itself. What is it about? What are the central elements in schema therapy? Might also be good to share some information about what could be certification processes. And to become certified, you definitely require some training, and I would like to inform you about the training options that we could offer to you. And we also would like to reserve some time to have some questions from your sides. It will be done in 1 hour, and I would like to make this as pleasurable as possible. So if you do have any questions in the meantime, don't hesitate. Let's make this a good hour where we learn something about schema therapy. And if I have to say anything about schema therapy, there are 3 sort of core elements that needs to be mentioned. The first of all has to do with the concepts, the language that we use. I mean, it's a therapy model, and every therapy model has its own language. But in schema therapy, we have a specific kind of a language, which is about core emotional needs, about schemas, modes. That sort of language is something that we use. The therapy relationship definitely is important in every therapy model, but in schema therapy, the therapy relationship is defined as a form of limited reparenting, and that makes it more typical for schema therapy. And then schema therapy is also a therapy model where we have a wide set of methods and techniques. And it's an integrated form of psychotherapy, meaning that all kinds of methods and techniques have been integrated into this model. As long as it's fitting, matches with the framework, with the language and the goals of this therapy model, you can do many different things. This is not a therapy model that solely leans on one technique or 2 techniques. And I would like to walk you through these 3 core elements to give you a sort of an impression what schema therapy might be about. First of all, then, the language that we use. The name is schema therapy, but actually, what is a schema? Well, actually, that is one of the most difficult questions to answer, even though it's a very simple word. But it's a sort of a theoretical construct. I mean, a schema is already known in other therapy models as well. Piaget described it in his developmental psychology, and CBT, it's already known. The way it's described is like it's more like a theoretical construct where it's about a cluster of information that a person gathers in life, a cluster of different types of information. When a child is born, is bombarded with all kinds of stimuli, like sounds and colors, etc. All that information is stored in a neural network, and it's clustered around certain themes. In that sense, a schema is sort of a filtering system. It helps us to make sense of the world around us. That filtering system helps us not to be distracted by insignificant information. So I pay attention to your facial expressions, and I don't have to do a lot of effort for that because my brain sort of discards any other information that is out there. The color of the curtains, I'm not paying attention to that. That is what schemas do. They are filtering systems, and filtering systems that are really at the core of our functioning. You could see the schema as the central core, and coming from those schemas, coming from those themes in your personality, certain basic ideas about yourself are being developed. So cognitive assumptions about yourself, other people, the world around you. These are more general assumptions. That is about how you view the world. Not always active. A situation like this could activate some of those ideas and could lead to automatic beliefs, like specific ideas about this particular situation. That is something that happens all internally. You don't see that from the outside. What you see is the effect it has. And when those core beliefs and those automatic beliefs are activated, it will have an influence on my behavior. That is something that you see. You could see it as an almost like an onion. You look at behavior. When you peel off that first layer, you will start to identify the beliefs I have about this specific situation. When you dig a little bit deeper, you come to these core beliefs about the world and myself. And way down, there's this schema, which has all this basic information in it. And for a long time, there was not much attention paid to what the schema actually was, because like CBT, we could work with all these other things like behavioral therapy, cognitive therapy. It's working on behavior and beliefs. And it could do that quite effectively. But however it was effective for some disorders, it wasn't effective in treating personality disorders. And that was the reason why there was a more focus on those schemas in the 90s of last century. Apparently, with personality disorders, these schemas are so strong that to work on behavior, on cognitions, wasn't just effective enough. More insight was needed in how schemas developed and how you could change them. Now, from the point of view of schema therapy, in our theory, the most important thing in our model is core emotional needs, which is not, it's not a mind-blowing concept. That is what I guess we all find important in life. I think we all agree that children should grow up in a safe world where there are safe attachment figures, where you can feel connected and validated, and where you can explore the world by expressing your feelings and thoughts, and by exploring, finding out what you like in life, what you don't like in life, and develop a sense of autonomy. And of course, there are realistic boundaries in life. You can't do anything that you like, but generally speaking, the world should be a fair place where there's not enough room for spontaneity and play. These core emotional needs are considered to be vitally important, not just on a theoretical level, but also in a very practical level. This is what we talk about a lot with our clients. And the idea from schema therapy is that if it's about the question, how do schemas develop, then it has all to do with these core emotional needs. So basically, the idea is when those needs are frustrated, not just once, but if they're not met, not validated, basically what happens is emotional wounds get inflicted. And that is how you could see schemas in our patients. Schemas are those cores that we have in our personality, but with our patients, these schemas are colored by unmet needs, emotional wounds, so to say. And with that theory, it helped to describe specific schemas because it becomes a bit more clear how schemas develop. Just to give you an idea of what it might look like, just one or two examples. So we all need that safety, that feeling that we are safely connected to people around us. When there's a lack of safety, it could be because of different reasons. Maybe because as a child you were abandoned, or there was an unstable life situation. Or another kind of unsafety might be that you were abused or mistreated. And the emotional wounds inflicted by all that, they will look different, they will feel different. So as an example of one scheme, it might look a bit like this.
Yeah, when you say something like that to me, like, oh, that's so amazing how you did it, it always makes me think, what is going on? What does she want from me? That's not a way normal people talk. That I just don't trust it. People are that nice, I don't trust it. There's something else that they want.
What sort of schema would that be? There were two different options. Milena, what do you think? What schema do you think this was?
Mistrust.
Yeah, definitely. Quite clear, isn't it? I mean, she actually says it almost out loud. But I guess it's not just the words that's brought you to the idea that this is mistrust. I guess it's also the way that she says it. It's the whole emotional system is activated. That's what a schema does. A schema is more than just a belief. Everything is sort of activated. A schema activated is almost like a tsunami in the emotional system. So the way that she talks, the sound of her voice, the way that we start to feel when we talk to a patient with this schema, it will feel different. It will feel different as you compare this to another schema, for instance, this schema.
Yeah, this morning, I don't know. My boyfriend was leaving the house to go to work, and he left the house without even saying goodbye to me. And he was like grumpy, and he didn't really say goodbye to me. And then I thought, what is going on? What's wrong? Like I thought we were fine, but then afterwards I thought, if he's like this, what's happening between us? Is this the end? I really felt like this is it. This is it. He's gonna leave me just like everybody else does.
What do we think this schema is? Natasha, what schema do you think this was?
Maybe it is schema. I am bad, and the world is bad. Not safe. The world is not safe.
Yeah. So partly there's an unsafety because people could do something to her. The thing that she talks about is more like her fear of being abandoned. So it is definitely about unsafety. I guess you're totally right. But it feels a little bit different than the first example, doesn't it? In the first example, she was more distrustful. Now she's more afraid. It all has to do with safety. So you're quite right. But maybe this, because it feels different, because it's more about the fear of abandonment, this is what could be called the schema of abandonment, instability and abandonment. Yeah, but definitely it has to do with that feeling of unsafety. And that's what is central to this therapy model. So what we have are those core emotional needs. And when those core emotional needs are validated, then you have this normal emotional development to us being healthy adults. Then life is not easy, but at least we can manage to some extent. But when core emotional needs are not met, then these emotional wounds are inflicted, and they can be quite strong. And it really is like a tsunami drowning you in emotional pain. So it makes sense that if children have those strong emotional experiences, they develop surviving mechanisms, coping styles. And coping styles just with a function not to feel all that emotional pain. And there are different coping styles that you could identify. When a schema is activated, it's that tsunami in the emotional system. Sometimes a child learns to give in to that feeling might be the best way to survive. To give in to the feeling of mistrust might be the best way to stay safe. Or another way to survive might be just to avoid feeling all that, to avoid situations that might activate that, or to fight it. So 3 sort of different coping styles. And with that, there's a language that was developed. So schema therapy was all about the idea that somewhere in the childhood, there's an interaction of different factors. It's not to blame a specific factor of those the specific elements, but what happens in that mixture of different factors, certain core emotional needs are not met, and that inflicts emotional wounds. Those schemas that cause suffering, and make sense that children develop surviving mechanisms, and they are functional. I mean, they work. It was the best way to keep your mouth shut in your childhood because that made it safe. Only when the context changes, then patients start to suffer. In their adult relationships, it's not the best way to keep your mouth shut. So this was the model of schema therapy for a long time. But then quite soon in the development of this model, turned out that this language was not really helpful with certain patients. So with certain patients, when you would explore those schemas, it wasn't that they had one or two of these emotional wounds. With borderline patients, it could end up with 12 or 13 or 14 different schemas. You cannot identify them, but the slide is just a way to show it's not really helpful anymore. I mean, there's so much of these schemas that it becomes too complicated. The language is maybe too detailed. It's not just that there are so many of those schemas, but I don't know how many of you work with borderline patients. Alejandra, do you work with borderline patients or have been working? Or
No, actually, I work more with grief and yeah,
so different type of patients. But you
yes,
can imagine that even with patients with grief, there are different emotional states that they show. It's not just that they're constantly in one emotional state. So they come in,
exactly.
they talk, everything is composed, and a moment later they become really emotional, maybe angry, and then they start to cry, and then they feel bad about crying. And then the end of the session, with all the work that you've done, it's all composed again. They detach a little bit, and everything is quiet again.
Yes,
Yes.
exactly.
And if you want to understand what happens in those sessions with the language that I showed you, it becomes a bit complicated. So you could do that. You could say, well, at first when the patient came in, what I could see is, well, it was more avoidance that I could see. And she was talking about stuff without showing any emotions. But as it turned out, when we were exploring those emotions, she really felt them. She really gave in to that feeling of sadness, of loneliness. Then she started to feel like a failure because she was feeling bad that she was feeling so sad. And then she started to fight that. And at the end of the session, the slide is just a way to show you it's too complicated. With some patients, it might, so many things happen in the session that it becomes too complicated to use this language. And that's why in schema therapy, the language of modes has been developed. So it started off with schemas, coping styles, but there was a need for a much simpler language. The idea is, okay, patients have these emotional wounds. Doesn't mean that they're always active. You can have 12 or 13 of those schemas, but that doesn't mean that they are always active in every moment of the day. Maybe that in some moments, certain schemas are activated, certain coping styles, and they define the emotional state in that moment. That's theory, but the simple language that you could use is that you could cluster all that and just talk about sides. You could talk about there's this detached side of the patient. That's the part of the patient where he tries not to feel anything. But a moment later, he flipped into a more emotional side, maybe an angry side of him took over. And that simple language of sides, of having different parts to the personality, that is something that is considered to be a mode. It's technical language, but it's something that I guess we all can relate to. I mean, you all have different sides to yourself, I guess. I'm now in my working mode. I'm focused. I try to focus. Maybe after this webinar, I might feel a little bit more emotional because my emotional side comes up because something happens. I can choose to where to focus on. And with patients, these sides are more extreme. So these different parts of them take over. They are not just a little bit emotional, but in that moment, they drown in their emotional sides. And a moment later, they detach completely. It's almost like all the feelings, all the emotions have been cut off. The point that I would like to make is, well, this is the part about the language that we use in schema therapy, and mode language is something that you will find in schema therapy. It's the language where you talk about having different sides, where you talk with patients about there's this emotional part of you, and we call that a child mode because it's linked to old pain, and that's the emotional part that's hurting. There's a protective side that you have that tries to stay away from that pain. And the tragedy for you is that it seems almost impossible to escape from that pain because time and time again, something happens in your life and that activates all pain. Maybe because that inner critic that you have in life got activated. And those internalized critical messages, they become activated because something happens. And old pain is triggered then. So we try to make sense of our patients with the use of this language, of having different sides to a person. Now, that's my first question. Are you able to follow? Are you able to understand what are you still with me? Good.
Yeah.
Because I throw a lot of stuff at your side. But at the end of the day, this is the part where it's about the language in schema therapy. We have language that is about schemas or coping styles, but at the end of the day, the most popular language that is used nowadays mostly is the language of modes, sides to a person. And this is a very simple language that appeals to a lot of people, not just therapists, but also clients find it helpful. They get that idea, like, yeah, I do understand. I have that emotional part in me. And I do sometimes flip into this really detached part of myself, that protective side of myself. So that's helpful. It helps to make sense of sometimes really complicated experiences that patients have. Well, let's move on because I would like you to have an overview of what schema therapy is about. Second core element is about the therapy relationship, which always is important, but from the point of view, as I explained it, basically what I said is, well, people are born with core emotional needs. And as I said, well, when these needs are validated well enough, there's no such thing as perfect validation, but well enough, then there's an emotional growth. Then we turn out to become these healthy adults that we are. And then, as I said, life still can be quite complicated. But for patients, those needs were not met. And basically what happened is they only learned to survive difficult circumstances. The emotional growth got blocked. So in a way, you have this, at the end of the day, you had this adult patient sitting in front of you, but on an emotional level, that little child that they once were on an emotional level still is there. The pain, that old pain is still there. And often people don't see it that way. They just see an adult person acting in a weird way, too emotional, too strong behavioral responses. But when you look at it from this point of view, it makes sense. Yeah, the body has grown, but on an emotional level, there's still that vulnerable child. And what you need to do is not just try to change behavior, because that won't do, that won't be enough. The idea from schema therapy is you need to redo that upbringing. You need to provide those corrective emotional experiences that they should have been having as a child. So to put it in another way, what you need to do is to sort of provide them with a role model of an attachment figure that they should have been having. They had punitive people in their life, blaming them. Now, what you need to provide them with is a role model of a healthy attachment figure. Someone they can internalize as a sound basis, a sound foundation. So basically, limited reparenting is really about forming a close and, quite personal attachment relationship with these patients. Not being the therapist from a large distance, but becoming a bit more closer. It's still professional care, and professionals' boundaries still apply. But it is about becoming a bit more personal, so you matter, so they form these attachments to you. And you can be internalized as a basis for a healthier path in their life. So it comes down, what do you do in limited reparenting? Basically comes down to the question, what do you do in parenting? Because many of the things that you do in parenting, you need to do in limited reparenting. Not exactly the same. It's limited reparenting. It's professional healthcare. But if you want to create those corrective emotional experiences, you need to offer care, definitely. Maybe a bit more intense, more personal than you're used to. You need to be very active, sometimes really have an opinion. You need to guide them sometimes in the start phase of therapy to make choices that you see as healthy choices. What I learned in schema therapy is that I sometimes need to be more active. I have an opinion. I really try to influence their choices. As a CBT therapist, I learned to to lean back and to provide them a place where they could explore, ask Socratic questions, which is very helpful if you're dealing with a healthy adult. With my borderline patients, that didn't work. So limited reparenting is about being more personal, not just warm and to the woody nice. It's also about what you do within parenting, confront the patient with empathy, but still confront them or set boundaries sometimes. It is really trying to sort of redo the upbringing. And just to give you a flavor of what that could mean, offer care is really about the question, what would you do if this would be your foster care child? So that means you can think about the things to say, but often it's not just the words, it's also just the warmth, your presence, guidance, and not be too active in trying to solve things, but just trying to stay tuned to the patient and provide emotional care. It might take different forms, but I thought of showing you something that could be used in schema therapy, which is an audio flashcard. How many of you know the concept of flashcards? Like maybe from your CBT training, you've learned to use flashcards. How many of you have heard about that term? No? Flashcard is just a simple reminder that you could write down on a piece of paper. So after you worked on an anxiety belief and you came to a different conclusion, to write down that conclusion might be a helpful reminder. So that flashcard, as it's called, you can keep it with you. For patients with personality disorders, that piece of paper won't mean anything. What could be an alternative is that you record the voice of the therapist, stating more healthy things to say, and to enable them to listen to that same message, but also with the same voice of the therapist between sessions. So the audio flashcard is a way to internalize those messages in a bit more profound way than just reading words on a piece of paper. Be mindful. I'm not saying you have to do this with every patient. This is specifically for people with a personality disorder, patients where cognitive behavioral therapy or other approaches don't seem to work. Just to give you an idea what it might look like.
The punishing voice has been triggered that tells you that you're worthless and tells you that everything is your fault. We know that this punishing voice comes from your father's punishing messages during childhood, but those messages are incorrect and unhelpful, and we won't allow those messages anymore. I can tell you now that I believe that you are worthwhile, you are a valuable, lovely girl, that you've got so much perseverance, such a lovely, warm, gentle personality. You're such a kind person. And those messages from your father are wrong, and we're going to tell them to go away and leave you alone. And even though your instinct is usually to hesitate and to punish yourself instead of asking for help, I want you in future to ask me for help, to listen to the flashcard, to remember that we are connected and that I'm here for you, and that I won't allow that punishing voice and that punishing message to make you feel bad any longer. That together we'll fight back, because you are valuable and you deserve to be cared for and to be looked after. Okay. How does that sound? Does that sound like something that you could use?
Yeah.
Yeah? Yeah?
Sounds quite nice.
Well, I really meant that. I really meant those things.
So just an example what it might look like. In this example, it was about fighting those internalized messages, in this case, that came from her father. But schema therapy is not about blaming parents or fighting off parents. It's fighting internalized critical self-reflections. Sometimes they can come from parents, but they can also come from teachers or other experiences in life. But the example shows you do it in quite an active way, that you try to provide them with a different language, something that is more validating for those core emotional needs. Be mindful of the fact that what you were shown just now is just an example of how offering care might look like. It's not just about being warm and kind and supporting. As I mentioned, you sometimes need to confront, you need to set boundaries. It's a set of interventions that you do. But this is what limited reparenting is about. Forming a more close and more personal relationship within the boundaries of professional healthcare, with the idea that what they need is to internalize more healthy messages, and that won't happen if you just talk about this or where you try just to change behavior. It needs to come from this more intense attachment relationship. That's the idea about limited reparenting. Yes, you have a question, Ati.
Yeah. So, hello, everyone. Sir, just like to clarify, and this flash or this recording that give it to the patient. So it's so when he's feeling down, so that's like can give it to him to listen, and as like motivation, or keep like connected with us, like with therapists. That's correct.
The last thing, and then through that connection that they can sense it in, also be accessible for those words, those arguments that you provide. So you provide them with a simple tool that helps them to repeatedly listen to more healthy messages, so it becomes more internalized as a sort of, you could also think of this as a form of counter conditioning. They internalize punitive, sometimes guilt-inducing messages. We need to provide them with more healthy messages, but it needs repetition. You need to provide them a chance to listen to those messages again and again.
Yeah,
This is just a way that you could do that. There are lots of methods and techniques. There's a large toolkit that we use in schema therapy, but like with a real toolkit, some of the tools we use more often than others. At the end of the day, whatever intervention technique you would like to use, it's all about validating those unmet needs. And the way to do that is to bypass their protective sides, to fight those inner critics voices. And through validating those unmet needs, then you are sort of strengthening the healthy sides. That's the idea. It's an integrative form of psychotherapy, meaning we use techniques that are aiming at emotional experiences. We're using cognitive techniques, but we also use behavioral techniques. And we've used those techniques aiming at different topics. Sometimes we talk about, well, quite often we talk about things that happen outside the therapy room, in the life of the patient. So things happening outside, but you definitely also sometimes will talk about things happening between the two of you in the therapy. In schema therapy, especially in the start phase, you will talk a lot of the time about things that happened in the past, but at the end of therapy, you will start to talk more and more about the future. And with all these different topics, you try to follow those 3 different pathways of thinking, feeling, and doing. And what you see, I don't want to sort of overwhelm you with all the words, but the message of this slide is you can do a lot in schema therapy. This is not a therapy model that only uses 1 or 2 techniques. You can use many, many different things that you might already know or that you already use. It's not about the technique itself, it's what it's aiming to do, validating unmet needs. Okay, having said that, some of these techniques that we use them more often. And I would like to show you 2 examples of the most frequently used techniques, proven to be effective. That's important. It's evidence-based. Imagery scripting is one of them. And imagery scripting is not from schema therapy. It's not developed by schema therapy. It's already out there before schema therapy existed. But the last 20 years or so, there are hundreds of studies showing that it's immensely effective in treating all kinds of pathologies. Just to give you an idea what it is, we use the power of imagination. When you close your eyes, when you think of something, you see an image. At least the vast majority of the general population is capable of doing that. It's not just a flat image, but it's an emotional experience. When we remember meaningful events from the past, we feel something when we remember. So mental images are emotional images, and the simple idea is that when you change those images or when you change the visualized events, then it will also influence the way that you feel. And in that sense, rescripting those images can serve therapeutic purposes. This is what it might look like.
I feel scared and
Yeah.
confused. I don't know why he's angry.
Yeah, yeah. Sandra, I just want you to listen to my voice, okay? Just listen to my voice. I want you to freeze the image there. Can you freeze it? And can you see me coming into the image? Yeah? Can you see me there? And where would you feel safe to stand? Would you like to stand behind me or next to me or in another room? What would feel safe for you?
Behind you.
Yeah, okay. Can you see that you're right behind me? Yeah. And I'm making myself bigger in the image, okay? So that I'm bigger than Dad, so I'm looking down on Dad. Does that feel safe for you? Yeah. And I'm going to speak to Dad. Dad, this is not okay. You cannot speak to Sandra in this way. It's unacceptable. It's rude. And you've got to start treating her nicely. She's your daughter. A good father would never speak to a child in this way. She's a lovely little girl, and it's so lovely that she wants to learn to play the piano. You know, she's so talented, and you don't treat her properly.
So what you see is that the therapist in this case, something that you might do in the start phase, actually sort of steps into this visualized image and then rescripts it in a way that is more matching, more validating for her needs. And weird as it may seem when you look at it from a distance, it might seem weird, but actually it's proven to be extremely effective. It provides those corrective emotional experiences on a real emotional level. The other technique that's frequently used is chair work. Again, not something that was developed by Schema Therapy, but in different therapy models, chairs are also used. Gestalt therapy, emotion-focused therapy, compassion-focused therapy. The simple idea is that a chair could represent something meaningful, and that could be anything. You could use the chair to represent a thought or a feeling, a conflict, a diseased person. Anything could be a representation, but a chair is something you can sit on and you can give a voice to whatever it represents. Now, within our therapy model, we use with those different sides of the patient. So a chair could be a representation of a certain part of the patient. Maybe the detached side of the patient can be sitting in that chair, and the patient from that chair can talk about why it's better not to feel anything. And weird as it may seem, when you step away from a chair, then it's not just a physical distance that you create, but also an emotional distance. And that helps to do therapeutic work. And again, might seem weird, but this is just to give you an impression of what it might
exactly
look
what I
like.
notice as well. The Sandra that I see today seems to be okay in the sense that there's no emotion, and that's no criticism, by the way. I'm just saying that the state that you're in right now is without any strong emotions, although I know you have an emotional side. You can feel a lot in your life, but not today.
Yeah.
Okay. Well, since that is what we both identified today, maybe we can work with that, and let's do an exercise that will help us to understand why that is, and also helps me to help you. Okay?
Sure.
Then I'll take this chair, and we'll ask you to sit over that chair for the next couple of minutes. Is that okay?
Yeah.
Thanks. Well, first of all, to compliment. I mean, dragging in chairs into the picture can be maybe feel a little bit awkward, but I'm just happy that you're willing to cooperate and try it out. And I also think that this will help us.
Okay.
What I would like you to do is, you already saw me waving with my hands, talking about different sides. Well, let this be the chair of the Sandra that doesn't feel, that sort of is okay, fine, without any emotions. We both know there is an emotional side, but in this chair, it's you not having these emotions. And I'm going to address you as such. Because I think, Sandra, that not having emotions, I don't think that just happens by coincidence or You just do that for the fun of it. I think in your mind, I guess it might feel like this is much better. This actually helps to not feel all the pain.
Yeah.
Am I right?
Yeah. I mean, sometimes all these feelings are not so nice or just too much, and then, yeah.
Okay. So not having these emotions in a way helps you to protect you against all that pain.
Yeah, I guess so, yeah.
Okay, and how do you do that? How do you do protect against all these feelings? Do you switch them off? Or?
Yeah, sometimes it's just like I can just...
Okay, so what you can see is you start up a conversation almost like you're talking to a different person. And that is how mode language could be effective. It's not just a theory, but to address her in this chair as the not emotional Sandra. And then after some exploring, ask her to step away from that chair. It's leaving that detached side behind. It's helpful to bypass these protective sides that patients sometimes have. So another technique that we quite often use. Anyway, before we move on to training options, this is what schema therapy could sort of be like. There are 3 core elements. We have a certain language, schemas, unmet needs, modes. We have a certain relationship with the patient of limited reparenting, and we have a wide set of methods and techniques. So far, so good. Any questions? Yes, Natasha?
I have a question. Is a schema therapy is a directive method?
A directive method.
Directive method.
Yeah, well, it can be, at least in the initial phase. So from this point of view, you could see therapy as a developmental process. It always is, I guess, but in our language, you could see, well, in the start phase of therapy, you could view the patients being emotionally at a very young age. We need to be guiding, we need to provide them care because they need some of that support, but it doesn't remain like that. So in the middle phase, it becomes more puberty, where our role is more guiding, so that in the end of therapy, it's more like what you do with adolescents. You sort of stimulate them to do things more themselves. So in the first part of therapy, it really is a very directive approach. In the very last part of the therapy, it becomes more CBT as we know it, where you provide them with helpful techniques and you ask them, well, have you tried it out? Wouldn't you be willing to try that out yourself now? So it changes a bit over time, but yes, and definitely it can be quite directive.
Sometimes I listen directive words, directive message, and I ask.
Yeah.
Okay.
Yeah, definitely. Yeah, what you see and what schema therapists share is that it's quite a talkative kind of therapy, at least in the start phase. You need to be quite active also in talking. So sometimes we learn in therapy models to lean back to provide space and room. This is a different point of view. You need to be active like you would be with young children sometimes. I don't want to sort of be condescending to patients, but it is a certain language that might sometimes help to understand why we do what we need to do, to be more active in helping them. Yeah.
Yes, dank u wel.
Graag gedaan. Hey, let's say that you're interested. Let's say that you feel like, well, seems, and not because it's just a good story. I will also talk about the fact that this is quite an effective treatment. That is the most important. This is all about helping patients. This is not about me, Remco, or organizations. This is about becoming more effective in treating sometimes difficult patients. But it might be good if you're thinking about learning about schema therapy, also be aware from start on that there are certification routes, so to say. There's an international society, but there are also national societies. And it might be helpful to be aware of what the requirements from those societies are. If you can become part of one of those societies, it's helpful because you have your support system, you have your I will talk a little bit about that in a moment or so, but as I mentioned, it is an effective kind of therapy. It's proven to be effective in treating borderline patients. Then the idea was, let's try it out in other personality disorders, which basically turned out to be a big group of cluster C patients, because the vast majority of these patients had a cluster C personality disorder. And schema therapy turned out to be very effective in those patients as well, superior to other conditions. In the forensic setting, In different settings like group schema therapy, it turns out to be effective. It's now also applied in eating disorders, anxiety disorders. I'm not saying that this is a miracle thing and you should use it for every kind of disorder, not at all. Follow the guidelines. But if you have a patient with a personality disorder, this could be your first choice of treatment. If you've tried out other approaches like CBT for your anxiety disorder and it wasn't effective, this could be a follow-up. Now, if that is what you're interested in, then for the International Society to become member, you need to have an academic training. You need to have a master's degrees in psychology in the country that you follow that study. And you need to be licensed to practice therapy. And whatever that license is, it can be different per country. Then you also need a training, 40 hours of training. You need supervision. It goes with every therapy model. And you need to have some type of experience with that. But these are all very reasonable requirements. So it's not too difficult to get 20 or 40 hours of supervision. You are here in the Netherlands, so it makes sense to say something about the Dutch society. That might make it a little bit more complicated, but then we have Psych Global that's able to help you with that. Because in the Netherlands, to become a schema therapist, you need to have this big registration. And that is quite a hassle, as I know, and you probably know far better than me. But that's one of the requirements. And you need to have training, not 40, but 50 hours. And you need supervision, 20 or 40 hours, equal requirements. It's good to be aware of that. It might be tricky to fulfill those requirements. So if you have a chance, then maybe just check with the organizations, maybe check the websites. And as I mentioned, it's not just the International and the Dutch Society. Maybe you come from a place, maybe you come from Ukraine. And since last year, there's also a Ukrainian society. They don't have a website yet, but you can email them and they can be able to inform you about the requirements. And if this is something of your interest, realize that what we are wanting to do, what we're able to do is provide you all kinds of training options. I'm just giving you a taste of what might be the options. There are all these training courses that will lead up to becoming a schema therapist. 4-day training courses as a basic training or a more advanced training, or you could combine them in a 8-day training course in total, so basic and advanced. Some of these 4-day courses can be focused on specific disorders like the cluster C or more specialized for group settings. But these are trainings that are really for therapists who want to become a schema therapist and who are working with adult patients. Similar training courses are available for when you work with children and adolescents. So specialized for that population. And then we also have a wide set of workshops that could be focused on different elements that might be of interest. So for instance, a specific disorder like depressive disorder or that whole concept of limited reparenting, a 1-day training just on that, or maybe the combination of imagery scripting plus EMDR. So if you have a specific need, then we could be able to validate that need by offering a training course. There are also 2-day workshops focused on sometimes techniques like imagery scripting. And that might be helpful because maybe you don't want to become a schema therapist, but imagery scripting is not just something that we do in schema therapy. It can be used as a standalone treatment for treating PTSD patients. So there are all these options, not just in person, but also online. What I'm showing to you is just an overview. And what we would like you to provide us with is some feedback. So Beer will talk maybe about that, about a form that we are sending to you, or that you can fill in, where you can fill in also your needs. Would you be interested in following one of these training courses? What type of course? What is your needs? That is something that we really would like to get to. Now, I've been talking for a very long time. Definitely time for me to stop talking and check with you guys if you're still alive and if you have any questions. Yes. I just say Hatim, but that's your family name, so I don't want to be
No,
disrespectful.
this is my name. This is my name.
Oh, that is your name. Okay, Hatim.
Yeah. Thank you. Yeah, sir. Thank you so much for really. It's really interesting. Like, I learn a lot of things. Second, I'm really interested in this Schema Therapy, especially because I'm working with right now with PhD with the war zone, like what's going on in the Middle East, especially because I speak a lot of language. So it's really like figure out that it's gonna help me a lot. And I'm working with depression, stress, and this stuff. So I figured that this method is gonna help me a lot. And the way and the skills that like give us, I guess it's gonna help us like with the treatments in the last time, and gonna be like really like focusing and strict for our patients. And I'm really interested in this. Thank you so much for that.
Well, thank you. I'm glad that you feel inspired, and I do agree. And again, and we need to be realistic. This is not a miracle thing that works for everyone, but yeah, it's proven to be effective for depressed patients. So in that sense, it might be really helpful. Imagery scripting, just as a standalone treatment itself, could be helpful in treating those traumatized patients. And yes, I also have been feeling very inspired because I've been struggling with my borderline patients in the 90s, and after learning about schema therapy, it worked. You could do stuff and it would be effective. Not it was like changing immediately, but it did have an impact. I'm glad that you could feel inspired as well. Yeah. What about other people? Do you feel like interesting? What about you, Natasha?
Yeah, it is very interesting for me. Now I learn KBT in Ukraine online, and I had the first module in the Netherlands KBT with Valentina Parubi. And I know the schema therapy is KBT same. And I think I know many different psychotherapy technique, and I know and I see in schema therapy I see many technique and methods when I know.
Yeah,
Yes,
I
and
can imagine. This is not
yeah.
the techniques or some elements you might already be familiar with. What I like about I don't want to convince you, but what I like about schema therapy, it sort of puts it together. It makes sense. It provides you with a direction, a sort of a structure, why we are doing what we need to do.
Yes,
Yeah.
and it is very interesting because I know KBT work only now. We don't go to outside and go to future, only now. But I think schema therapy work now, in future, and in last time. Yeah, and it is very good. It is very effective because sometimes client ask about it. I would like look to my childhood or but KBT only now, and we go.
Yeah, and extremely effective in what it does. But again, like I agree, it provides you with more things to do in schema therapy, maybe. Yeah, nice to hear. Yeah, I'm being aware of the time. I see Bear moving around a bit, so I'm not sure if you would like to say something or close the session. Because we don't.
I saw two more people that maybe wanted to ask a question. I saw Milena raising her hand. So maybe if we have time for a few more questions,
definitely. I
then,
like questions. So please do.
Then we do that, and then so Milena, what would you like to ask?
Yeah, thank you. So you were talking about limited reparenting, and that you can form an attachment with a client.
Yeah.
And for me, it is very interesting how exactly can you set the boundaries and limits with them, because I think both you and the client will form an attachment. It will be quite difficult for you to finish sessions, especially if they had very traumatizing childhood and they want a parent, and you become an attached figure for them. So how exactly do you do it?
Yeah. Yeah, definitely. Well, what you point out is definitely something you need to be mindful of, and it's not as a coincidence that the Dutch society makes it a clear requirement that you are part of a peer supervision group when you do schema therapy. You need your support system. You need extra eyes watching what you're doing. What is also helpful is that you, in the phase of the case conceptualization, that you ask yourself, what type of parent do I need to be for this particular patient? And maybe my patient wants to be really attached and feels dependent, but maybe what he needs actually is more autonomy. So what a patient wants is not always what you need, and it's helpful at the start of therapy to think about what is the parent that this patient actually needs. It's also helpful to think about your therapy plan, to have a plan when you start therapy, to be aware that there will also be an end of therapy, and I need to work towards that moment. Because if you don't have a plan, then it's so easy to sort of slip into a pattern yourself, and then the attachment becomes stronger and stronger. But to what purpose? There's an aim, there's a goal that you work to. It's great that you have this dependency in the start phase because it makes you important. It makes the patient want to know or starting to ask himself, like, what would Remco do in this moment? Not because that I'm so super, but they need some sort of helpful attachment figure. But it's in the first phase that they can do that. But in the middle phase, you will start to coach them to do it more themselves. So a plan is also helpful to protect yourself against that unhealthy form of attachment. Yeah. That makes sense. There was a second question, was it? Thank you, Milena.
Yeah, I don't know. I don't want to. There's thought someone else was still asking, raising the hand, but if not, I don't see any other.
I was checking the chat, but no questions there. Hey,
No, I will comment maybe on the last part a little bit from global side, but maybe first, Ursula, would you like to close and then I'll say some last remarks? But
Yeah. Well, thank you, Remco. It's just very interesting, very inspiring, and also for me to see that this method is so helpful to let patients understand things and makes more sense to them. And also, I was thinking about I don't know if I can call it a trend in CBT, that some therapies are given by multiple therapists, so it doesn't matter who the therapist is. And this is kind of like the opposite, but it's really clear on what the goal is and what that makes sense. Yeah. So thank you for that. I think we have come to today's webinar with this. I'd like to thank all the attendees very much for participating, to be active in the chat. I see a lot of comments in the chat, and thank you for your attention. Special thanks to Remco, of course, for sharing your experience, providing us with such valuable knowledge about schema therapy. We appreciate the time and the effort you put into making this very informative experience for everyone. And we hope you found today's webinar very helpful and inspiring for everyone, and we look forward to welcome you to future events. What I would like to point out, Remco mentioned the different kinds of workshops, therapies, and everything. I know, I can imagine you are very excited to learn more about those. In the near future, you can find also on the website of Global possibilities to maybe participate in some of the workshops or trainings of Remco. So there is a lot more to explore and a lot more possibilities. Yeah, would you like to say something else, Remco or Bear, for tonight?
I'm just very happy with your participation. and just being willing to listen to this and being open to this model. I hope that you feel inspired, and it's all about needs. I think your need will not be to stay here with us for the rest of the evening. You have a life with other needs maybe. So listen to your needs, go to your family and friends and enjoy life. And maybe we'll see each other some other time in a training or workshop. Who knows?
Thank you so much.
Great.
Have a good night, everyone. Thank
Thanks,
you.
everyone.
Thank you.
so
Thank
much.
you.
Bye.
Say
you.
global thank
Bye.
you too.
Oh, bye.
Bye.
Good night. Thank you.
Bye bye. Bye Natasha. Bye Alejandra.